This is a joint presentation with the Sex and Gender and Emergency Medicine Interest Group, AWEM and ADEM. I'm your host. My name is Jeannette Wolfe. I'm an associate professor at UMass Medical School Bay State campus, and I am the podcaster of Sex and Why. What is our goal for tonight? It is very simple. We all want emergency medicine to be the premier specialty in excellence in patient care, medical education, and research. To do that, we believe strongly that we all need to have a foundation and be up to date in some of this new moving science in sex and gender. Our students are expecting it, our research funders are demanding it, and our patients deserve it. So this is a first step. Here are our teams. This is a gender Jeopardy game. We're going to play a board. We have 3 teams competing against each other for 3 different awards. The first team is UCSF. They won this competition last year. The second is VCU. And the third is Johns Hopkins. I'm going to introduce the captain of each team, and they're going to introduce their other team members. We'll start with Hopkins. The team is led by Gabe Kellen, who is the chair at Hopkins.
Yeah! To my left and to your right is Leah Bright. She's APD in our program. And to my right and your left is Alex Jensen, about to graduate. Are you?
All right, Hopkins.
Yeah,
To my right is UCSF, again, the champions from last year. And they are captained by Elena Famoska. Woo!
To my left is Dr. Rosny Daniel, and to his left is Dr. Andrew Merriman.
And our final team is VCU, which is captained by Greg Wilhoit.
Hey guys. So to my left we have Robin Hempel, Quality Safety, and Nehal Naik, 4th year med student.
Woo! All right, so here's the rules. This is like a Jeopardy-style game. There will be one board. You have to go through all of the questions before you check your buzzers. Can everybody check to make sure their buzzer is working? You will get points for the questions that you answer right. You need to answer it in Jeopardy format. What is? For every question except for the male-female category, if you do not get it right, it can go to a second buzzer. Our judges today, representing multiple different institutions, from Brown is Allison, from Yale is Basma, from Brown is Angela, and our scorekeepers from Brown are Neha and Karen. There will be 3 awards: highest score, best team spirit, and social media award. These are the different social media sites that if you are for VCU, Hopkins, or UCSF, please grab a hold of and tweet out. So here are today's categories. The basics. Male, female. That means the answer is either male or female. Expert opinion. Research. 1, 2, 3. The answer in this category is either a 3-letter word or an abbreviation with 3 letters. And broken hearts. So.
Can you repeat those, please?
We are going to start by, I'm picking a number between 1 and 10. Gabe, what's that number?
3.
It is, actually.
Go for it.
Gabe gets to go first. What is your choice, Hopkins?
Basic definitions for 100.
This refers to one's chromosomal and hormonal makeup.
What is sex?
Oh, when do we do this? Oh, they got it. Oh, biologic sex.
In compared to gender, which refers to the roles and expectations a person has within a societal context.
Yeah, we knew that. We didn't want to show off right away.
Well, you're not going to win, sorry.
This is a almost outdated already Canadian Institute of Health research. Every cell has a sex. Every person has a gender. And why is it outdated? Because gender is not binomial. And just so we think that this is not a 2015 changeover, in the American Indian culture, there were two spirited folks who were born biological sex, male or female, and were believed to be two-spirited and have female and male spirits. Oh. You guys are UCSF. Oh. That was UCSF. Clearly, yes.
All right, Lita, you get to pick. Oh, is that it? Was that a question?
Whoa. Everybody gets 10 points. Correct term for someone whose assigned sex at birth is female, has a male gender identity, and is physically attracted to females. Here's what. VCU, you better know this because Joel is your chair of ADEM.
Straight, yeah, straight trans male.
Transgender straight male. And this is just to remind us all that gender identity is distinct from sexual orientation. That was everybody got 10 points for that because I screwed it up.
Woo. We'll take it. Wow.
Okay, we're going back to you guys because you got the first point.
We will take Broken Hearts for 500.
Go big or go home. This cardiovascular disease is currently grossly underdiagnosed because it involves more distal vessels and can easily be missed by a standard cardiac cath. Any takers? It's for $500.
Hey Siri, what's this cardiovascular disease is currently... No, I can't do that? Oh.
Any audience members who wants to get a t-shirt for knowing that answer?
Is it reverse Takayasu?
What? Yes, you're right. Microvascular disease.
What does that have to do with that?
Microvascular disease is disease. Yes, it was amazing. Microvascular disease is not the disease of your big pipes, it's the disease of the small vessels that go into your heart muscles. It's caused by hypertrophy, external compression, abnormal flow, and abnormal endothelium. Why this is so important? We see these patients every week. These are your middle-aged women who have hypercholesteremia, who have smoking, who have non-insulin dependent diabetics, and who just had a clean cath last week. A huge portion of these people have this disease, and we don't yet have tests for it, and we don't know what good medications to have it. Go back to UCSF.
We will go to Broken Hearts for 400.
This syndrome, which is going to be shown by an ultrasound clip.
What is Takotsubo's cardiomyopathy?
Yes.
Yes. That was 400 for UCSF. Maybe you should just move it over there because the UCSF folks might know a lot of the answers and that way they can get credit. So for those of you who don't know what Takotsubo stands for, it's for octopus pop because what your heart looks like, classical apical sparing, apparently has the same shape as that octopus pop for which they kept octopus in. This is another ultrasound to show the complication of Takotsubo, which is clot.
I've seen it like twice.
So Takotsubo is caused, or believed to be caused by a catecholamine surge. Over 80% of the people who have it are women, and they, however, if men get it, they apparently have a much worse outcome. UCF, it's back in your corner.
Broken Hearts for 3.
This is a study that was published just a few weeks ago by developing a standardized STEMI protocol. Cleveland Clinic dramatically decreased their blood gap in 30-day mortality.
No, they're in.
What kind of gaps can there be?
What is gender gap?
Yes, what is gender gap? We're going to take just a second so people can look at the difference in 30-day mortality from before and after they initiated a 4-step protocol. The end game, the female mortality went from 10% down to 6.5%. The male went from 4.5% to 3.5%. Importantly, however, that gap of 6% decreased dramatically. This is what the protocol included. Standardized cath activation, a STEMI safe handoff checklist where everybody had an assigned role, immediate transfer to an open cath lab, and radial artery access first.
Question, point of order.
VCU, it's up to you.
Wait, question here. Shouldn't that answer have been sex gap? Shouldn't the answer have been sex gap?
I think the problem is that some of it was a gender gap and that the nurses were not checking off the female patients. So that is a great question, defining the difference between biological sex and gender. Excellent point, Chairman of Hopkins. Woo!
I think Hopkins should get an honorary 300 points.
I'm not to bribes yet.
Male or female for 500?
So this is the only one that the other team doesn't get a second chance if you miss it. Standard needle decompression of pneumothorax is less likely to work. Yellow.
What is female?
Yes.
Good job. You would have gotten it. You would have gotten it.
And this is why your standard angiocath is 5 centimeters long. About half a female's chest are about 4.5. So in many of our female patients, that needle is simply not long enough to go into their pulmonary space.
Yeah, we knew 2 answers.
UCSF.
Let's go back to Broken Hearts for 2.
The acronym SCAD stands for the STEMI mimicker that affects younger women who are often postpartum and without any cardiac risk factors.
Pumping artery disease.
Okay, that's going to be a t-shirt for the audience. Who knows what SCAD? Yes, nice job. Spontaneous coronary artery dissection. What the heck is this?
Oh, wow.
It's a dissection of your coronaries. And people who have 0 risk factors get this. It seems to be related with dramatic hormonal shifts like postpartum. The important picture I want you to look at is in the right lower quadrant of this picture. Because when these people rip, their flap goes way open. If you actually try to stent this, you can actually make their condition dramatically worse. So this is one of the reasons we should get EKGs on everybody with chest pain, because every now and then you're going to get dramatically surprised.
Wow. I had no idea that was big. That's terrifying.
All right, Hopkins, you get to choose the board here.
Oh, what do you guys want? What do you think we know? Male or female? All right, male or female, 400.
Higher stroke risk from this.
What is male?
Is it us?
Who was it?
Did we get it? Okay.
What?
What is male?
That would be no.
Ah.
Who's working?
What is female?
I thought you said male. No. Oh, sorry. My bad.
So to remind everybody, your Chad Bass score for AFib, female sex, is one of the variables.
That's true. Right. Dang, that was minus.
VCU, why don't you have the board?
Yeah, we got it right. They got it wrong, we got it right.
Basic definitions for 500.
So this is my favorite party trick for every sex and gender talk I ever give. Which hand belongs to someone exposed to more prenatal testosterone?
It's the hand on the left. Oh, what is the hand on the left? The ring finger. What?
Green.
Oh, who has the answer here? VCU? VCU.
What is the left hand?
So, to clarify, do people with more prenatal testosterone have longer index fingers or longer fourth fingers?
What is longer? You said index finger? Index finger.
That would be wrong.
It's the fourth finger.
I actually knew that. I just looked at it wrong.
So to remind everybody, testosterone comes in two patterns. It's your organizational pattern that when your brain is marinated in testosterone, when you're in utero and going through puberty, there are permanent tracks that set up lifelong patterns of information spreading. If anybody ever had an idea of potential sex differences based on testosterone marinating in your brain, look at the difference between the average amount of testosterone in males and females at the age of 17. There's also an activational component of testosterone, and this causes transient changes of how you perceive risk, and this is due to competition and dominance.
Activational?
And this slide is just a reminder that if you're going at it with somebody else in the trauma room, sooner or later the conversation might subtly change from what is right for the patient to who is right. All right, who's behind the most so they can go next? VCU?
Yeah,
VCU, why don't you go?
Let's do basic definitions for 300.
Significant distress caused when an individual's assigned sex does not align with their gender identity.
What is gender dysphoria? What is gender dysphoria?
Yes. We're just going to go through this one really quickly because we already did it.
What?
All right, VCU.
Basic definitions for 400.
Tweet us. Are you guys tweeting us?
The percentage of the 2017 medical school class that's self-identified as LGBT within 3%.
15%.
No.
Yes.
What is 10%?
Yes.
What do you say?
So self-identified 8%. Importantly, however, of that 8%, how many were actually going to come out to other people in their class?
2. So these are all people who are
Is that I can't hear. Is that a bonus? Is that a bonus?
self-identified.
That wasn't a question.
Oh, okay.
That was just more of an educational point. So about 8%, but of those, a third of them won't come out to anybody.
I think we lost points on
So VCU, you're up again.
Something 500. 1, 2, 3?
1, 2, 3 for 500.
All right, to remind people, the 1, 2, 3 is either a 3-letter word or it's an acronym with three letters. You said 500?
3 letters or 3-letter word.
What does that mean again? What does that mean? Wait, what is what?
So, this is for VCU. This is a double 1, 2, 3. There's no question yet. This is the question. Oh, you have no points?
No, what's a double?
A double, I'm going to tell you. So a double 1, 2, 3 means it's 2 words, and each word has 3 letters. So the double 1, 2, 3 And how many points are you going to guess?
That virus.
How many points can they guess?
What is that virus? Like causes cervical cancer.
300? 310. You have 310 points, VCU. What are you going to bet?
But it's humorously.
Is that okay?
Gender.
10 points.
10 points. Wow. So a recent popular B&J article humorously focused on this, quote, gendered infectious condition and underscored how even common illnesses can affect men and women differently.
I mean, it could be STD, but it couldn't be that. HPV.
So that was originally open up to the other one, so we're going to have to do a 1, 2, 3 count to see which one of you guys want to do it. 1, 2, 3.
We hit it.
Who's behind? They are? They're good. They're behind.
Do we get to answer it?
Yes.
HPV.
Nope. We got it.
So,
Nope. We got it. Can we go? Can we go?
so just to clarify, it's 2 words.
No.
No, you said 3 letters.
2 words. So it's a double 1, 2, 3. So 2 words, each word, because it's a double Jeopardy. There's a little play on word though. If you want to have one more guess, you can.
We're ready.
Okay, I think that UCSF knows the answer.
What is man flu?
Yeah. Yes. Woo! Man flu.
That's real.
Whatever. How far ahead are they?
No, it is.
So like 25. So flu differences between men and women. Men have a decreased immune response to the vaccine. Men have higher smoking rates. They're less likely to see a doctor, and they have a greater death rate from the flu. With the asterisk of pregnant women have the greater death rate of them.
Can you get me some soup? I feel so bad.
Can we take 1, 2, 3 for 400?
So to clarify, the rest of this is just one word with 3 letters. Women who are taking a blank appear to have less severe symptoms after a concussive hit.
What is OCP?
Yes. So let's talk about traumatic brain injury differences between males and females. There's differences in prevalence. Overall, men are more likely to have a concussion. However, for the same sport and the same hit, women are more vulnerable and have a lower threshold for a G-force and a concussion. Women have more cluster of symptoms with their concussion. There's differences that are based on neck strength, and there is a hormonal influence. So currently there's this theory called the progesterone withdrawal theory, and that when you get conked on your head, it mixes up your hypothalamus, pituitary, gonadal organ. So ironically, people appear to be most vulnerable for concussive side effects if they're hit after they ovulate when their progesterone level is high. The idea is the delta difference between having a high progesterone level, getting knocked on the head, and then having your progesterone level fall very dramatically because you're no longer producing it because you have this concussive hit. The theory as to why women taking OCPs do better is because they're taking a synthetic hormone that does not rely on their pituitary and hypothalamus system. All right, who's behind?
I think they got the.
Well, you can let them know.
Question, right?
Oh, you did?
Yeah,
Yes,
got it.
sorry. Sorry, guys.
You can let her.
Thank you.
Can we do 1, 2, 3 for 300?
I didn't hear the first part.
1, 2, 3 for 300.
Men are more likely to get this if they collapse in public.
Yep.
Yellow.
What is CPR?
Yes. If you collapse in public, it's better off to be a guy. And the overall odds of survival are 23% greater in men.
Probably because people think that guys have heart attacks more.
UCSF?
We will do expert opinion for 400.
So expert
Wait for the
opinion.
question to finish.
Clarify?
Wait for the question to finish.
So with the expert opinion, these are videos. You have to go through the end of the video. If there's a question that you do not understand what the actual question is, I can repeat it.
Oh, hey.
My name is Esther Chu. I'm at Oregon Health and Science University. This enzyme is more active in the stomachs of men than women, meaning for the same amount of alcohol consumed, more is absorbed into the bloodstream for women than men.
So before you go, I'm going to repeat that because I'm not sure everybody can hear it. What Esther said, and Esther does sex and gender-based medicine research, is the enzyme in the stomach that breaks down alcohol so that for the same amount consumed between a male and a female, the female has a higher level absorbed. Yes, Hopkins.
Alcoholic dehydrogenase?
Yes.
That was a daily double, right?
Oh, I'm sure it's a daily quadruple.
Okay, daily double, you heard her.
So the enzyme is your alcohol dehydrogenase in your stomach appears to be revved up by testosterone. So if you have more testosterone, you rev up that enzyme, you break down more alcohol, and less is absorbed. It's also believed that this is one of the reasons why there's decreased absorption of Ambien or zolpidemine in men versus women.
Wow. Well, I shouldn't use it?
Hopkins, your choice.
Research for 500.
In 2015, the NIH required that basic scientists doing animal research do this.
VCU.
What is sex balancing, like gender balancing?
So expand on that. You're on the right track.
That animals that are in research both have equal number of on either side of the trial or whatever study have both male and female animals.
So believe it or not, in 1993, the NIH, to get funding, you had to include males and females in your human trial research. It wasn't until 2015 that the NIH required that basic scientists include the sex of their animals in their lab. Why is this important? Until that time, 80% of all basic science research was done on male lab animals. This graph shows a very nice problem that happens when you only study male animals. If you look at the neuroscience, the physiology, and the pharmacology, these authors went and looked at all of these different trials, and they said, what was the sex of the lab animal? If they even actually included it in the paper write-up, it was the vast majority of the time men or males. And why is that important? Think about where our new drugs come from. They come from basic pharmacology and basic neuroscience and basic physiology.
Can we have a judging update, Jeanette?
I think we want a score update.
Oh, no, I want to give an update on the social, on the hashtags.
Excellent.
Just to let everyone know, currently Hopkins is crushing the Twitter game.
All right, Hopkins.
In second place is VCU, and UCF is needing some love on Twitter. So if you're feeling their game, you guys please tweet them out. It's the name of the team followed by Gender Jeopardy. So VCU, Gender Jeopardy, UCSF, Hopkins, etc. You're winning.
All right, can we go over the point selection over there?
Research 400? Research 400?
VCU has 1210, UCSF has 1230, and Hopkins has 10. Woo! I think perhaps, would it be okay if we let Hopkins, because you guys might want a job on the East Coast sometime, just thinking.
We are on the East Coast.
All right, Hopkins, the board is yours.
It is? All right, research for 400.
That's okay, that we're going to pick anyway.
A recent analysis of medical device approval studies showed that men and women were included in more than 90% of the studies. This percentage, however, within 5%, did sex-specific analysis of their data.
What is 10%? Yeah, but they didn't do the study right.
What is 70%?
What
is
was it?
70%?
70?
T, 70,
No,
70. 70.
No, so you guys, just by doing some pure math here, might have a great shot. So it's within 5%, and it's not 75%.
We're not risking the points.
We're not going to risk the points. All right, who wants to get a T-shirt? So they did the study. They included men and women, but they only analyzed their data for sex difference and what percentage. It's not 10%. It's not 78%. No, not 35. No, not 50. Go down. 20. We'll take 20. Woo!
We were the closest, just for the record.
So this underscores that if you just include both genders or both biological sex, but you actually don't analyze your data, you don't get very far.
Our answer was not statistically significant, so we should get the points.
Your answer is the confidence intervals clearly probably had 15% in them. So 82 studies, 17% were looked at sex, only 9% by age, and 4% by race. All right, Hopkins, because you still only have 10 points, you get another choice.
All right, 300 for research.
This is a great question. This came from Alison McGregor. Currently, both sexes must be studied in new drug trials, but not so for bioequivalent releases, which means generics. What percentage of drugs currently prescribed in America are generic? Within 10%.
What is 30%? What is 30%?
No, it's not 30%.
What is 10%?
No, it's not 10%.
What is 60%?
Everybody lost a lot of points there. We'll just cut it even. 80% of all drugs right now are
Once
generic.
again, I just want for the record, for everyone, Hopkins was the closest, and this is a non-equivalency, so it didn't meet statistical significance.
So here's the deal. None of the drug companies have to do generic studies comparing biological sex of males and females. And people, when they looked at generics, believe it or not, the inert components with the generic medication, they affect men and women differently, and the plasma levels of their drugs may vary significantly.
Wow.
I know. Who knew?
Adults are not just...
All right, Hopkins again.
Research for 200.
Yeah, I love that. Whoever just said that, women are not small adults. Yes.
I think it's still us, right? Yeah, so research for 200.
A recent sampling of random controlled trials from major journals from 2008 to 2013 had this percentage of unexplained in their conclusions over representation of males within 10%.
Yeah.
What is 65%?
No. We need to increase the variance next time. It's lower than 65%. That's a hint for Hopkins, who only has 10 points.
We have no idea. Is that close enough?
All right. What percentage of randomized controlled trials from major journals had an unexplained overrepresentation of males? 35, a little bit higher.
45.
40, that's a great answer. Woo.
We got it on the 5th try.
So there is a difference in selection and exclusion bias, limited analysis, and limited discussion. So it's not just enough to study males and females together. You actually have to look at your data and analyze it after the fact. All right. Hopkins, one more time.
Expert opinion, 500.
I'm Allison McGregor, the Associate Professor of Emergency Medicine at Brown University. and the director for the Division of Sex and Gender in Emergency Medicine. It's the first academic emergency medicine division dedicated to advancing the science of sex as a biological variable and gender influence on health and disease. And my question is, which measurement is associated with the sudden death of more women than men because of its influence on both sex and gender?
So the question is, which measurement is associated with an increased risk of sudden death in women compared to men?
What is troponin?
That's a great answer, but that's not the one we were looking for, and I'm not sure that's true. But I don't think you should lose points for that because I think it's a good answer. I'm going to give you another hint. EKG finding.
What is ST elevation?
Another EKG finding. EKG finding that when it widens, we get really, really worried. Go ahead. Oh.
QT?
They get.
So nobody's going to get points for this, but it's a really good answer. It's QTC. So the important thing here is, this is one of the take-home points here. Women are much more likely from QTC prolongation to die. And the reason for this is, nobody's getting any points, but nobody's losing any points.
No, we got that.
Yes. The reason this is testosterone is associated with increasing your potassium channels, and you have more potassium channels open, you have a faster repolarization. However, that's the biological sex difference. And as men get older and their testosterone levels fall, they have a slight increased risk of getting their QTC prolonged. But there's also a gender difference, and that's because women are more likely to go to doctors and they're more likely to get scripts. So this is a great ad campaign from Europe. We need to study both sexes and both genders, all genders, to see what their effect is on the medications we're giving. If you give a woman Cipro, they're on methadone, you give them some allergy pills, then they come in with nausea and get Zofran, their QTC could go farther and farther and farther apart, and then when they end up dead, people are going to just think they had a methadone overdose. Okay, we're winding down. Hopkins. So we're going to change the point levels now so everybody has a chance to almost win. So we're going to triple. In fact, we're going to go by 10 times higher the last several points.
Expert opinion for 300.
So this is for $3,000. Expert opinion for 300.
Hi, I'm Basma Softer. I'm an emergency physician and director of Chest Pain Center at Yale. I do sex and gender medicine because it influences the patient's diagnosis, management, and outcomes, regardless of the disease. My specific interest is cardiovascular, so here's the question. Sex influences the interpretation of this specific test, which is readily available in the emergency department for the diagnosis of acute myocardial infarction.
So we're going to repeat that. Sex affects the interpretation of this commonly used test in the emergency department for acute heart attacks. Go ahead. VCU.
I'm going to go with troponin again. What is troponin?
Yes.
It's actually what is
So this is a great journal club paper if you have not seen it, because it shows both the sex and the gender differences and heart attacks. This is a European paper. What they did is they checked bread and butter conventional troponin and put it against a high sensitivity troponin and looked at outcomes. It didn't really matter if you were a guy and you had a high sensitivity troponin or you had a conventional troponin, but it mattered a lot if you were a female. And some of this probably goes back to the microvascular disease, in that if you have a smaller heart and your disease process causing ischemia to your heart is more distal vessels, you may not get the huge troponin leak that you would if you're a guy who's having a STEMI. These are other common lab tests that also have different sex-specific cutoffs: creatinine, uric acid, hemoglobin, calcium, and cholesterol.
They do. Yeah, if you look in the comments, it says it.
Okay, VCU, you're up like thousands now.
Male or female for 300?
Another 3,000 point. Everybody get ready, because it's 50% chance you're going to get right. Who is more likely to be found in a shockable rhythm after a cardiac arrest?
UCSF.
What is
Did they
male?
actually
What
wait
is
till the
male?
end of the question was done?
Yeah, we waited.
All right.
What is male?
Yes. So this isn't quite a straight cardiac arrest. This study in particular, this is people who have ROSC. But if you get into ROSC, you are much more likely to have a shockable rhythm if you're a male versus a female, and it dramatically affects your CPC outcome. Okay, UCSF.
1, 2, 3, 200.
The blank is slowly fading out the lettering category of a drug's supposed pregnancy risk.
Yes. What is the FDA?
Yes. So how many of you guys actually knew this was happening? You know that B classified level, C classified level, those are all going away. And they're replacing it with this called the PLUR, or called the final rule. And the idea here is that, as we all know, many times new drugs come onto the market with very high up towards the beginning of the alphabet lettering for protection, with really no great data with this. The idea behind this new final rule, or the pregnancy and lactation labeling rule, is that we're going to have more updated medication, more updates to allow us to know real safety of meds. So here's sort of a scary statistics. 50% of pregnant women take 4 or more drugs during their pregnancy. And the CDC estimates that we only really know about 10% of drugs really risk for pregnancy. All right.
Expert for 2.
My name is Angela Jarman. I am an emergency medicine physician and a fellow in sex and gender and emergency medicine. If you're interested in a career in academics, I highly recommend this fellowship, regardless of whether your interest is research or education. As many of you know, our main funding agencies are now requiring that investigators look at sex as a biological variable, so it's a great time to be doing research. And there are also many opportunities in education to fill the gap between our new knowledge and existing curricula. My question for you is, among traditional cardiac risk factors, diabetes and this risk factor carry significantly greater risk of developing coronary disease in women compared to men.
Did everybody hear the question? Diabetes and this risk factor have significantly greater cardiovascular weighted risk factors for women versus men.
What is hypertension?
That is unfortunately not the right answer.
Cholesterol?
Correct.
You want the specific one?
So that's a tricky one, and I think you should get half points for it, because if you have a low HDL and a high triglyceride, it is a different risk for women versus men, but that is not the greatest risk factor. So you guys have a good choice. There's like 2 risk factors left.
What is smoking?
Yes.
Yeah!
My name is Angela.
This is a huge different risk factor in men and women, and many of the women we see with premature coronary artery disease are big-time smokers. It increases your rated risk by 25%.
Wow.
All right. We are running out of time, so we're going to run through the rest of the board pretty quickly. So why
Go
don't
ahead,
you guys...
200, that sounds good.
All right, this is a study everybody in the room should know about. If they don't know about this study, you should read it in your faculty meetings, and you should read it at your journal clubs. As a third-year emergency medicine resident, more likely to get higher ratings of milestone evaluations and more consistent feedback.
VCU.
We're actually going to give this one to Hopkins because they're so far behind you guys.
Please do.
Yeah, you're supposed to wait. It's okay. You know this answer.
Men.
Males.
Okay. Males and men are
So
kind of the
this
same.
abstract was presented 2 years ago in New Orleans. They have published it. It's in JAMA Internal Medicine. Over 33,000 milestone evaluations. No difference between male and female evaluations as PG1s, but by the time you're a PG3, if you were a male, you had greater evaluations across all 23 competencies. The follow-up article on this by Anna Mueller, she went through one of the hospital's comments with the other authors of the original study, and she found out that there seemed to be a big discordance of how feedback was given to third-year residents, especially when it came to autonomy and assertiveness. Specifically, if you had a male third-year resident who was really challenging, whether I gave them feedback or whether Gabe gave them feedback, they got very consistent feedback. And by the way, it doesn't matter who was giving them feedback as far as the gender of the evaluator. However, if we were giving feedback to Alina over here, Gabe and I, one of us might say, Alina, you need to be much more of a team leader, and the other one might say, Alina, you need to take more input from other team members. So trying to figure out how to help them move along, we've got some work to do within our specialty. If this topic interests you, I interviewed both of the lead authors on this. It's going to be on my podcast next month. All right, Hopkins.
Oh, yeah, male or female?
Higher mortality if you break this.
UCSF.
Did we get it?
Who's it? It's you guys.
What is female?
That is actually not true.
What is male?
It's not entirely clear why this is, even if you factor in for age and comorbidities, males, when they break their hip, and it's much less than females, but if a man breaks their hip, they're much more likely to have increased one-year mortality. These are the guys who probably need to go to medicine with an ortho consult. Okay, 4 left.
Expert opinion. Oh. But I need an expert
Go ahead.
opinion all the same.
Which one did you say, expert?
Yeah.
My name is Bruce Becker, and I'm a professor of emergency medicine and behavioral and social science at Brown University. I've been practicing clinical emergency medicine for the last 32 years. I think that sex and gender is incredibly important to consider when treating our patients in the emergency department. Why? Because more than half of our patients are women, and their problems are unique, their response to medications is unique, and their presentation, diagnosis, and treatment in a whole range of clinical problems that we see every day is unique. More than 10 years ago, a medication was approved by the FDA in a dose that was only tested on men. When women started taking this medication, a host of unfortunate side effects occurred, including car accidents, bizarre behavior, and all sorts of other trauma. This medicine was subsequently redosed for women. What was the name of this medication?
What is Zolpidem?
Yeah, correct.
What is it?
What is Zolpidem?
Yes. So there are both pharmacological and pharmacodynamic differences between men and women. There are also gender differences because, again, women are more likely to go to their doctor to complain of not sleeping. They're more likely to have a script written for them. And importantly, because women have more history of anxiety and depression, they're more likely to be on a medication that will interact with zolpidem. Yes. Excellent job. My job is done. All right. 3 questions left.
Hearts for 100.
Men are more likely to have this syndrome. All right, Hopkins.
Brugada.
Yes.
They didn't say
What is?
They're so happy. All right, 2 left.
Research for 100.
Funding agencies, IRBs, journal editors are increasingly required that researchers include this biological variable based on your chromosomes and your hormones in their study design and analysis.
Hopkins.
Sex.
Yes.
I hit it.
Thank you.
The abbreviation for this commonly used drug that has been shown to help men, but not women, prevent an initial heart attack. Yeah.
UCSI.
What is ASA?
I think they put it us. They got it? You got it? She put it us.
Who needs the points? They were both tied.
We thought they put it us.
Okay. We are now going to our final Jeopardy question.
Give them both points. Give them both points.
The judges, who did you give the points to?
Both.
Both of them. So this is our final Jeopardy question. For those of you who are interested in sex and gender, please consider joining our interest group. We have a meeting tomorrow at 8 a.m. This is where funding is. This is where medical education curriculum is. If you are a young investigator, this field is wide open, and you can make a name for yourself pretty easily in it. So this is our final Jeopardy question. It is also a video. You have to vote. So,
So VCU has 2510, UCSF has 8730, and Hopkins has 4310.
all right. So think about how much you're going to bet on your final question. Please do it on the honor system since I don't have anything up here for you to write. So this also is a video.
Hi, my name is Dr. Kara Tannenbaum. I'm the Scientific Director of the Canadian Institute of Gender and Health. I'm a practicing internist and geriatrician. And the reason sex and gender-based medicine is important to me is to be able to deliver personalized treatment at the point of care, and more importantly, to avoid harm. So my question for you today is, severe hyponatremia is a complication of this medication indicated for nocturia and various bleeding diatheses in women much more frequently than men. Because of the hyponatremia, sex-specific dosing is approved in both Canada and Europe.
So the bottom line here is this does not have a sex-specific difference in the United States yet. It's a drug that is used for nighttime enuresis, which we don't use it for, but we use it for something else, for bleeding diathesis, and it causes hyponatremia and seizures much more so in women versus men. So before we go to the answer to that, Angela, who's won the social media tweeting contest? So Hopkins has won the social media contest. That is excellent.
Yes.
And how many tweets out do they have?
Hopkins wins at 23 tweets, most of them by the gracious Dr. Hansotti.
All right, woo!
And VCU has a total of 11 tweets, followed by UCSF at 3.
And before we run the final announcement of who gets this beautiful trophy, we need to get the Spirit Award. So I'm going to go through each desk, and you tell me by clapping loud which team should win the Spirit Award. The first one is Hopkins. The second one is UCSF. And the third one is VCU. I'm going to give Hopkins one more chance. Is anybody in this entire audience want Hopkins to win? All right, judges, who wins the Spirit Award?
You're not going to be joining us?
VCU guy.
Angela, who won the Spirit Award?
I would go with VCU.
VCU, congratulations, winner of the Spirit Award. So before we go and give you the answer, how much should you vote, Hopkins?
We'll wager it all.
They're going to wager it all. So Hopkins is wagering 4,000. UCSF, how much are you going to wager?
Yeah. I don't know.
2,000?
Or she was like, who is it?
20 points? Okay. And VCU, how much are you going to wager?
0, please.
0. All right. So Hopkins, what is your answer? The question again is, what drug causes hyponatremia and seizures that's used for enuresis and bleeding diathesis, more so in women than men?
DDAVP.
Yes, Hopkins! Wow, strong finish! The answer is DDAVP. Oh, the answer also 20 points from UCSF, DDAVP. And the final team did not vote. So who is our final winner? So the final score, VCU, 25-10. Hopkins, 8,620. That was a really late rally. Nice job. And the winners, the second year in a row, is UCSF with 8,750.
They studied.
So this is what you win. A nice, beautiful SAEM Jeopardy trophy. And our own Dr. McGregor and Dr. Becker's Sex and Gender book. Plus there's t-shirts for you over there. Thank you everybody for participating. Have a wonderful meeting.